Good afternoon, everyone. I'm Becky Wittes, Chairman of the Niagara County Legislature. Thank you for joining us live on LCTV for our daily Niagara County COVID-19 update. We are also live streaming on lctv.net and 90.9 FM on your radio. First, the always hardest and worst part of these updates that I have to announce is that we do have one new reported death in Niagara County related to the COVID-19 virus. This was a 65-year-old male with underlying health conditions. Again, we send our condolences, of course, to the friends and family of this individual and to all of those who have suffered a loss at this time. We can't imagine personally what you are going through, but please know that we are here. You're in our thoughts and prayers, and we continue to think of you at this difficult time. The rest of our update is as follows. We have had 32 new positive cases today to report. This is a big number. It is our biggest number in one day so far throughout this crisis. But we also believe that this number is a byproduct of the factor that we are doing more testing recently in Niagara County. So while this number is a bit shocking, it's hard to hear 32 new cases in one day. It's not surprising to the professionals, of course. It underscores that we are not on the downside of this curve yet. We've continued to say that, our numbers are still going up here. They're hopefully not going to go up drastically. We want to keep this on a level field, but we certainly are not into the downswing yet. That gives us a total of 326 positive cases to date in Niagara County. Of those positive cases, there are currently 154 individuals in isolation. 136 of those are isolating at their homes, and another 18 are currently in hospital isolation. The good news, of course, is that we've had 154 individuals who have recovered, and unfortunately now a total of 18 deaths related to COVID-19. This number can be a bit confusing. We have continued to consistently report the numbers we have been, but I just wanted to explain a little bit because I know there's been some confusion about the numbers. When we give the total number of positives to date, to get that total, you need to add together all of the individuals who are currently sick in isolation, the number of deaths that have occurred, and the number of recovered individuals. And that's how we get back to that overall number of positive cases in the county. As I said, testing has been increasing here in the area. We have been able to get more kits than we have been in the past weeks, which is very good news. So far, we know that we've tested 1,440 individuals in Niagara County. And that number, again, comes from the state COVID-19 tracker map that is put out by New York State each day and updated. And you can find a link for that state map on our niagaracounty.com webpage. At the top of the page, there's a COVID-19 banner, and you can find the link for that state map, which will break down those numbers and statistics by county so that you can see where we stand throughout the state. Our Niagara County heat map, of course, has been updated again with those new totals today. Again, you can find that map on niagaracounty.com at the top in the COVID banner, and you'll see that we continue to show higher numbers, of course, in our more densely populated areas of the cities, with fewer in the outlying areas. But again, we see that every area of our county does have positive cases, and we know that there are many, many more individuals who would test positive if given a test. More good news out of the governor's briefing today. We did hear again that hospitalizations and intubations statewide are down. They continue on that downward trend that they've been on for several days now. There were 438 deaths reported statewide for yesterday, which again is slightly down from what we've been seeing over the previous week or so, but still a very large number of individuals. That is a large number to hear. It's shocking to hear how many in one day. But again, on the downward trend, downstate. We know that we are not in that downward trend yet here in Niagara County. We have felt for a long time now that we're slightly behind the time frame that the downstate area is seeing, and we continue to watch our numbers each day to reassess that. The governor also talked quite a bit today about antibody testing that's been done over the last few days. Now, antibody testing, what that will tell you is if you have previously had the virus. They can tell that by doing that sample. These tests were done randomly in grocery stores and big box stores in the area, 3,000 across the state. Those were randomly picked. They were not pre-announced. They wanted a random selection of individuals who just happened to be out shopping at those stores so they could get a good cross-section. The governor tells us that 13.9% of those 3,000 people who were randomly tested came back and showed that they had that antibody, meaning they had previously had the COVID-19 virus. Upstate, that number was lower. It was only 3.6%, which is good news. But of course, that's tempered by the fact that, again, we are still seeing our numbers rise here, and we might just be slightly behind the statewide average. The governor also expressed concern again about a potential second wave that could hit. That's been discussed by the CDC as well. We know the flu pandemic of 1918 came in 3 different waves. There is concern, of course, that if we stop our efforts too soon and we quit following those guidelines that appear to have been working, that we could trend back upwards again. And, you know, if we do that too soon, we could see another wave of this upward trend happening again in the fall. And we certainly want to avoid that. That will be when the regular flu season is arriving as well. So we certainly want to see, and we need more expansive testing in the area for not just testing for individuals currently with symptoms, but again, that antibody testing that can give us a truer snapshot of what's happening in the area. It has been a continued frustration across Niagara County as we order tests and haven't been able to get them in. Recently, we have been seeing an influx of tests coming our way. We have some great partnerships now. We're getting more tests here in the area, and that is good news. We have more test kits. We're going to be able to prioritize those and do more tests here in the area, again, to give us a better idea of the numbers that we're looking at and the trend that we're seeing here. And as you see today with our numbers, more testing will mean more positive test results. The bottom line is that we can't make accurate and informed decisions when we don't have an accurate picture of what's happening. So again, we will continue to work on getting those tests, getting the correct individuals tested to get an idea of what's happening, making sure that our first frontline responders are being tested that need to be, those individuals, again, you know, working with the public, our healthcare workers, our first responders, all of those individuals. The governor also spent a lot of time today talking about nursing homes, and both the Niagara Gazette and the Buffalo News had articles, front page stories actually again today on COVID-19 in nursing homes and some of the discrepancies that we're seeing there in the reporting numbers that come back. We've told you many times, of course, that the Niagara County Department of Health does not oversee nursing homes. That's done on a state level by the State Department of Health and regulated by them. So again, we don't always get the numbers coming back accurately to know the true situation there. Governor Cuomo today wanted to underscore the obligations of nursing homes under the law, and you'll see a screenshot now from his press conference this morning. He told us that by law and regulation, nursing homes must require personal protective equipment as well as temperature checks for their staff. They must isolate COVID residents and quarantine. They must separate their staff and transfer COVID residents within a facility to another long-term care facility or to another non-certified location if needed. They must notify all residents and their family members within 24 hours if any resident tests positive for COVID or any resident suffers a COVID-related death. And they also must readmit a COVID-positive resident only if they have the ability to provide adequate level of care under the Department of Health and CDC guidelines. And if they do not have the adequate care, they need to find a way to move them to a facility that does. He also announced today a joint investigation between the New York State Department of Health and the New York State Attorney General's office to ensure that nursing homes are following these guidelines and meeting their obligations. So while I've said oversight of nursing homes rests with the New York State Department of Health, however, our county Department of Health is certainly ready and willing and able to work in partnership here locally with our local nursing homes, with their residents and the staff to help ensure that they have what they need to keep their residents and staff safe. We're doing what we can to help them get the testing kits that they need and providing those to different facilities as we hear that we need them. And I want to thank Dan Stapleton, of course, our Director of Health, for doing that, going above and beyond. Again, not his obligation. That is a state obligation to oversee those nursing homes, but of course they're very important to us, and we want to do everything that we can where we can. So I appreciate that partnership, and we will all work together to be sure that our residents are safe. Now, back to Niagara County government, as we see essential businesses across Niagara County seeking to comply with the governor's executive orders regarding face masks. Again, businesses who are open and working have been mandated to provide masks to their employees who have direct contact with the public. We also now know, after the second executive order, that anyone who cannot maintain the 6 feet of social distancing while out in public needs to wear a mask as well. So certainly that will apply to employees who are working together in smaller offices or who can't stay that far away from each other if they're still out and about. So we had a press release today. Legislators Dave Godfrey and Jesse Gooch announced that the Niagara County Department of Emergency Services has obtained a supply of cloth face masks, and those are going to be made available to essential businesses in the area that need them at no cost. We know that some companies have had a hard time finding masks to supply to their employees, and we certainly want to help with that so we can help ensure that they are in compliance with the governor's executive orders. The masks were acquired through the New York State Division of Homeland Security and Emergency Services, and Legislator Godfrey tells us that any business deemed essential should qualify to receive those. If you're an interested essential business owner and you need those masks, you should email Niagara County Emergency Services at karen.thompson@niagaracounty.com. Please note that supplies are limited, of course, but we will do our best to make sure that any business that needs those masks for their employees will get them. So please reach out again. It's karen.thompson@niagaracounty.com. Again, this time for us all is filled with uncertainty, with anxiety, with worry about our health and our loved ones, about finances, about when we'll get back to normal. We're all cooped up in home, and the weather, unfortunately, hasn't been as nice this past week as we saw a few weeks ago. A lot of people dealing with anxiety, depression, issues that are coming to the forefront right now with everything that we're facing. We certainly have residents who are seeing more concerns with substance use disorder or alcoholism. We know that our domestic violence cases are on the rise. We have children who are home who would normally be in school with teachers and other adults keeping an eye on them and making sure that everything seems okay in their life. So we worry a little bit about Child Protective Services and wanting them to know if there's a situation that maybe is a little off and someone needs to make a phone call. So again, I remind you, call that child abuse hotline that's on your screen now, 1-800-342-3720. If you expect there's a child who is in a situation that could be harmful, please reach out on their behalf. It is Child Abuse Prevention Month here in Niagara County. Also, our Niagara County Crisis Services line is available to you 24/7. That's free and confidential help for anyone who's struggling right now, whether it's you yourself or you have a friend or family member that could need a little extra assistance right now. Please reach out to them. That number is 285-3515. We've said before, we are all in this together. It's not easy for anyone, so please, if you're struggling, reach out. Also, think about your friends and your neighbors who might be alone and not have family members to reach out to them. Give that person a call. Take 5 minutes out of your day just to touch base with someone that maybe you wouldn't normally. Check in on them, see how they're doing, let them know you're thinking about them. Everyone, for now, if you've missed us, joined us late, you can catch us on demand on lctv.net under the Niagara County Legislature links. We are also going to be replayed on their schedule throughout the evening as it allows. And we thank again, of course, all of the other broadcast stations and reporters who have picked up live to get this information out to our community or are using this information in their reports that they're writing. Again, thank you to LCTV for the partnership, allowing us to reach out to our residents at this difficult time. Everyone, please stay home, stay safe, and stay healthy.